Welcome to Genomics Gupshup. Genomics Gupshup is an initiative by MapmyGenome to create a community around genomics and to simplify genomics for everyone. And we do this by bringing together experts from allied areas like medicine, genetic counseling, nutrition, fitness, and more. Please join us as we spread the word about this exciting science of genomics. And we are now available on your favorite podcast as well. Just search for Genomics Gupshup on Apple, Spotify, Amazon, or Google Podcast. Today, we have a very, very special guest, a highly distinguished doctor, professor, Narendra Malhotra. And he's been doing this, he's been an OBGYN for the last 41 years. He's extremely, extremely well recognized. So we are really excited that he's here with us today. And this is episode number 55. He is currently the managing director of Ujala Cygnus Rainbow Hospitals and Art Rainbow IVF, Agra, and he holds various professorships at Dubrovnik International University and Sarajevo School of Science and Technology in Croatia. So it's not just in India, but he has he's been a professor for other schools in other universities across the world as well. He has a very illustrious career that spans over 41 years. He has pioneered advancements in fetal and maternal medicine, reproductive genetics, ultrasound imaging, minimal invasive surgery, and aesthetic gynecology. He has conducted more than 25,000 IVF cycles, authored 69 medical books, and delivered more than 3,500 lectures worldwide, which include 65 orations, and served as a past president of leading medical society like POGSI, ISAR, ISPAT, and IFUMB. And he's a member of many national and international organizations, including the Indian Medical Association and AMS, Federation of Obstetrician and Gynecology Society of India, Indian Academy of Human Reproduction, National Academy for Reproductive Child Health India, Indian Association of Gynecology, Endoscopists, Federation of International Gynecology and Obstetrics, Indian Oceania Federation of OBGYN, and American Institute of Ultrasound in Medicine and Biology. I think I can go on, but I think I don't want to keep Dr. Malhotra waiting. So welcome to the show, Dr. Malhotra. It is such an honor to have you over here. You have really pioneered a lot of things, so we can go through it, as much as we can in this 1 hour that we have with you. So welcome.
Namaskar. Thank you for inviting me here to this very interesting. I've been following this show since a very long time, and I was just waiting when you want to call me. So
I think
very interesting concept, and this is how we can take awareness and about common problems, or not only in women, in the whole society, also in general, also to the grassroots where people can get aware and seek help very early, so we can make a healthier India and a happier society.
So I know that there is many exciting things that I want to talk to you about, but maybe first thing, I also noticed that pretty much your daughter, son, and wife, everybody is a doctor. So is it running in your genes?
So we are probably the only family in India, or maybe the second, whose 4 generations have been doctors.
Wow.
My grandfather was a very, very leading physician surgeon of India and the principal medical officer of Rajasthan. He studied in Lahore and migrated to India, settled in Shimla first, then some allergy brought him to the plains, and he was offered the principal medical officer Rajasthan and the principalship of the SN Medical College of Jaipur, but he did not take that. And instead he planned to settle in a small village called Bharatpur, which is about 60 kilometers from Agra. And that is where my first 2 years of life was. And after retirement, he worked with the kings of India, and he was given the Rai Bahadur also, which is equal to the Padam Shri today. And he was then my father, a surgeon, and mother was from Bombay, KEM Hospital, a gynecologist. She came and settled from Bombay in Bharatpur, and they started a small maternity center in Bharatpur. And Bharatpur being a very small place, we shifted to Agra in 1959. So since then, 4 generations of only OBGYN practice, grandfather, parents, both of us, and both our children, Niharika and Dr. Keshav. Keshav is specialized in IVF only, and while Niharika does all the OBGYN and genetics work. She's worked in England, Keshav's worked in Australia, and they both decided to come back and settle in Agra and give their services here. So we are a family working together since 60 years plus.
Wow. That's quite fascinating that everybody is been in the OBGYN space. So I guess, you didn't really feel that it was something different for you, because I was going to ask you, the next question was that, I'm sure that it's not easy being a man in a OBGYN world. So, was that something that was particularly
Yeah,
difficult?
so that has another story, an interesting story behind it. I was studying in Medical College of Aligarh, AMU, which is a very, very conservative city of Muslims.
Mhm.
And I met Jaideep in my third year, and that's where we were classmates. And once we passed out MBBS with flying colors, both of us, in the top four, I think. And then came the chance to choose a specialty. So because we had a OBGYN setup working, I told Jaideep, you do OBGYN, I'll do surgery, and then make a good combination. She wanted to do pediatrics. She said, if I'm going to do OBGYN, you are going to do it with me. So when I walked into the dean's office, because we were toppers, so we had a choice of choosing any subject. There were no entry exam NEET that time. I walk into the dean's office. So they asked me, okay, you are in the top three. What subject you want? I said, I want OBGYN. So they all laughed at me. You are in Aligarh. It's all a very, very conservative society. The patients will not show you. How will you learn? I said, whatever it is, I am a third positioner, and you will have to give it to me. So that's how my head of the department, Kusum Saxena, madam, was very, very, she said, I want a boy in my department. I was the only first male OBGYN from Aligarh Medical College, a Muslim university, to do MD gynecology. So it was very good. I mean, I was expert in all administrative. I looked after the whole department. Of course, operative was very good. It was only in the outpatients where the little bit problem was there, when these women would not agree to show to a male gynecologist. But after me, there were 3, 4 more who joined in the next 4, 5 years. But then I became a registrar on my side, so they had to show me. And then I became quite popular with my gentle attitude. I was a sportsman, so everyone in the university also knew me. So it was an interesting journey. We enjoyed. And of course, Jaideep was me, so we were, if I was having problems, she would help me in the night duty. I would help her in the night duty. All that was togetherness was.
So this was a joint decision that you all made in.
Yeah. So it's because we had to look after the OBGYN, there was no other choice.
No, but that's great, because I think, there was that movie also, right, recently that.
Yeah.
Yeah,
So I did give some feedbacks in that movie and what my life, it was a little bit like that. And a couple of other male gynecologists from Bombay also gave a feedback on how they should make. And in fact, I've written my personal biography called NM at 2 a.m. NM at 2 a.m. Because all the OBGYN happens at 2 a.m. I don't know why. So my life has been all around 2 a.m., waking up in midnight and working, going back to sleep, working again. That's how life is.
But a lot of people now are, I mean, I had two babies. So one was born in the US and one was born in India. And I know that the first one, that was more a natural one. And it took a long time, the whole night. And then by the time I delivered in the morning, it was quite a, strenuous exercise, right? Like both for obviously for the woman, but I remember my husband getting more tense than I was.
That's true.
But and there was a very interesting episode over there where my husband was like, she's suffering. You need to, do a C-section or do something. And she basically, my OBGYN said, "Who is the doctor here, you or me?" Basically, I think asked him to relax and just sit over there. But I'm saying these are all difficult things. I think it can sometimes be all night. But I see a trend of planned pregnancies or planned births, rather, I would say. over nowadays in India. What are your thoughts on that?
So that's happening. I mean, alarmingly a lot. Alarmingly. I mean, we deliver about 4 or 5 babies a day, and 50% of them are timed. They don't want to go through the labor pain. They don't want to have a normal delivery, despite of us having a whole gamut of exercise, counselors, everything. They just don't want any pain. They want an epidural if they want in the normal. Then that leads to instrumental deliveries. So a timed cesarean section by choice, well, because it's women's rights, women's empowerment, they get what they demand. So even we can't say no. But then they come up with very, very odd and funny timings. Like today also at 9:22, I want my baby out. So I have
No,
9:22. Now, I mean, the anesthesia can take an extra time. The incision to
right.
baby, it might not come at 9:22, it might come at 9:23, but that's what we face. And one doctor couple, they came to me, they came unregistered, not showing to me, but showed everywhere else, including Delhi.
Mm.
And they said that we want a cesarean section. I said, okay, fine. We'll do it tomorrow morning at 10 o'clock. That's my routine time. No, no, I want it at 3 a.m.
Okay.
3 a.m. night. I said, but the staff is threadbare and whatever operations happen in the night lead to more complications. No, doctor, I'll pay you double, triple, 4 times. We wanted 3. I said, sorry, we don't do that. And they got very angry with me being a doctor, you're not helping. They went away, okay, fine. But that's somewhere we have to draw a line. So we have to count somewhere. So doctors are being blamed for cesareans, doing extra cesareans. It's not that. It's now 50% on women's demand.
So
So
it's
that
both
that
sides.
is happening. पंडित ने बोला है आज थर्सडे को नहीं कराना, सैटरडे को नहीं कराना, मूल आ गए, मूल में नहीं कराना,
No, I
डिस्चार्ज नहीं लेना, एडमिट नहीं होना इस दिन.
so I remember in my second baby was born in India, and I think there were both sides, right? What you mentioned. One was that the doctor said based on the scan, we would prefer to have a C-section because baby is bigger. But the other was also my mother-in-law saying, I'll go to the Jyotishi, exactly what you said. And I was
Yeah.
like, I don't, believe in all of this thing, but, she came up with that. And ultimately, I think, it was done. So there is that whole thing in India about the right time
Very,
and all of
very
that.
superstition time. Janam Patri pehle make a the Janam Patri pehle. Look at the best time and the future that baby will have later on.
So जन्म पत्री तो बनाते हैं लेकिन जीनोम पत्री भी बना रहे हैं क्या यार आई
Yeah,
मीन
I know.
क्या करना
Genome
होता है
Patri
कि दैट
banana
इज
बहुत
मोर
जरूरी है.
इम्पोर्टेंट
Yeah, and we also say marriage kundli में भी match करना जरूरी है. So premarital testing and premarital analysis. Now, because of love marriages and all, because that is not possible, but with arranged marriages, that could be. We have a section where we have a set unit of test. Premarital, this is your marital kundli, and please match that.
yeah
But that
that's
is
what
also very
we
important.
correct so I mean when we started MapmyGenome in 2013 I think one of the things that we decided was that people didn't know understand the genetics what is all of that so we
Yeah,
called
yeah.
the product Genome Patri saying that वो जन्म पत्री मैच करने से better is to match with
Genome
जन्म
Patri match
पत्री
karo.
तो उसमें कैरियर स्क्रीनिंग वगैरह you can do that
Yeah,
so
yeah.
I think that's
Because
very
there are these
important.
diseases, hemoglobinopathies, thalassemias, Tay Sachs, rare diseases in utero, which are occurring so many now. They all can be,
Correct.
even if you marry the same person which you like, and one of them is a carrier, we can counsel you and get you through a normal pregnancy by doing the testing and
Correct.
pre-genetic analysis or whatever. So it's not necessary that if your genome is not matching, you don't get married. You still get married, but we have an option of taking you through a healthy pregnancy and
Absolutely.
assuring that your child is born healthy, not with the same disease. So that's what is important, I think.
Yeah, that's why I keep telling people that, it's not it's about what you want, but you need to know that this is something that can happen in the future.
That's true.
So that's why you need to be able to do that. The problem is what we see normally is that a lot of couples, they have a problem with the first pregnancy and then they come for counseling saying, will this happen again? And I keep telling people that people who can afford to do these kind of tests should do it, because it just helps in just understanding whether there is a likelihood of something happening to the child. And if they're ready to, one is to say that understand the possibility of that happening, and two is to be able to make decisions based on prenatal testing as well. Lekin that awareness is still a little, I think it's
The
much better.
first awareness has to come to the doctors only.
Correct, correct.
We have to make the doctors genetic aware, or gene education, I think. And then only they can say, yes, we have. Because the minute even, see, a normal practitioner in a three-tier city or village, if he gets a report of a nuchal translucency more than 4, abort kar do. I mean, that is not the way to
That's
go
not
about it. You have tests, you have screening, you have, I mean, babies with more nuchal translucency can be totally chromosomally normal. That understanding, these tests have their limitations. So counseling is very important. So to counsel, we have to first teach the doctors and then teach and it's very important to teach the patients also, because then they can come and ask the doctor. Then the doctor has to read and guide the correct way, or guide them to the right person. That also doesn't happen. People don't refer to the right place. They feel like my practice will go away. So that mindset also has to change still.
correct. Because I think ultimately, see, the medical education hasn't included a lot of genetics. So I can understand that there is still there is still more that we can do from a
Yes.
education point of view. And the second is that I think, we have to collaborate to be able to get to a point where
That's
everybody benefits, right? Most importantly, the patient. And, patients, if they are not aware, they won't go to their doctor. And if the doctors are not aware, they won't be able to advise the patients on anything that needs to be done as well. So, but you've been doing this for a very long time. So what would your main advice be to women who are planning babies, or is there something else that you see that maybe they should have done that they are not currently doing, other than, let's say, carrier screening? Or
so women who are planning pregnancy. When I was the president of Foxy in 2008, we started propagating folic acid. And me and Dr. S. Suresh from Chennai, who's a ultrasonologist, I asked him, how do we propagate this so that the neural tube defects, the first thing we can control is a controllable defect. So he said, let's name it engagement pill. So the minute they get engaged, give them a box of folic acid pills, which they start taking. So that engagement pill was started by us in 2008. So the first thing is, a girl and a boy, if they get planning, they must get a complete health checkup so that they are healthy. I mean, apparently healthy people may be carrying some diseases. So that is where, and they are vaccinated for all the diseases. So that vaccination, especially girls for rubella and all, which can cause havoc. Then we have to make this couple nutritionally prepared. So in nutritionally prepared, I mean, they have to take the right diet, right this thing, and this folic acid supplementation, which we call it the engagement pill. Now I'm propagating folic acid from adolescent to menopause. It's the cheapest intervention for women's health. Right from 12 years of age to 80 years of age, if a woman takes one folic acid tablet, which costs only 20-30 paisa and not even more, and even if you take the fancy one, it's not more than a rupee or so, that should be taken. Otherwise, 3 months before they are planning a pregnancy should be minimum. Then they should do a lifestyle adjustment, because young generation today is all into recreational drugs, late night parties, alcohol, passive smoking, hookah, shisha, all that has to go away from your life. Excessive of caffeine has to go away from your life. Not more than 2 cups of coffee a day. That's the maximum. Not more of one a glass of red wine twice a week. That has to go. Smoking is totally no. Your weight control is very essential. You have to maintain a BMI from about 18.5 to about 25. And be sure you're not too thin or not too fat. Then these girls should track their menstrual cycle. There are ovulation monitors, there are apps which will tell you which is the best fertile period for you to get pregnancy. Otherwise, we broadly tell them day 10 to day 17, alternate day intercourse would work very well for most of them. Then the last thing which we advise, or the most important thing, is the mental and emotional readiness. Because we see the life today is so stressful, right from adolescent to menopause, that the minute you tell them pregnancy, where is the money? Where is this thing? Where's the time? Where is my career? I'm going to get a raise next month. If I get pregnant, 9 months, I'm out. My husband will not look at me. I'll still have to cook food. And all that mentally, you have to be ready. And you have to have a very strong support system. So Jaideep and me, always propagate live in a joint family. Don't live alone.
I agree.
You live in a joint family, see how you enjoy that mental support. Of course, sometimes you'll have a tiff with your mother-in-law, but that's okay.
I fully agree. I mean, we were in the US, my first pregnancy. My mother-in-law came, my mother came, both of them came. And then I moved back to India. I had grandmother-in-law, I had mother-in-law, I
So
had everybody in the
that's the fun
family.
of it.
Yeah. So I keep telling people that, I am from Rajasthan. We moved to, my husband is from Andhra. And my mother, obviously, I think at that time was a little bit worried, but it has been so great because one, like your family, a lot of our family members are doctors. So one is that that they are being well taken care of, and grandparents and great grandparents, you can't.
The
Uh,
most wonderful thing you can have in your life. I lost my father recently, 2 months back at the age of 94. And 2 months, the whole family is feeling lost because we have grandchildren, Nirali and Navkar, 11 and 5. And he was on the wheelchair. But he was there. He was talking, joking, making fun. The whole thing gets lost completely. Even if they're not doing anything, they're still there. That's the fun of, and that advice which they'll give you, one or two sentences is.
I completely agree because I think, but I should have known earlier. I would have loved to have him included in our longevity study. We did one on the Indian population. So my
Yeah.
grandmother was 105 when she 4 or 5. We don't know the
Oh my
exact
God.
age, but she died when she decided that she's done. Like after like you mentioned, giving advice to everybody, right? So I think there is definitely that value in having a multiple, generations because everybody's perspective is different and it really helps in building that.
Absolutely. And it gives you so much of insight on what life actually is and what it was from then to now.
तो आपके करियर में फ्रॉम द टाइम शुरू से अब तक बहुत सारे एडवांसमेंट्स हो चुके हैं राइट सो जो 41 इयर्स पहले आपने किया और अभी जो कर रहे हैं वो बहुत अलग होगा तो व्हाट आर द बिगेस्ट चेंजेस दैट यू हैव सीन इन द लास्ट 41 years since you've been involved in this practice?
So in the general life, from booking trunk calls at a corner telegraph office and waiting for hours to get through to a call from Bombay, to sitting in your bed and doing a video call, has probably been the biggest advance which I see. In medical science, when Jaideep and me were doing post-graduation in 1983-84, the ultrasound had just come in. So Aligarh Medical College was one of the first few medical colleges which had the ultrasound, and Dr. Jaideep's thesis was on ultrasound, which was the first thesis written. So that we were well ahead in advance. And I did on cardiotocography. Again, a very, very modern equipment to be placed in 1982, 83 in a medical college. Private sector probably had it before. From then on till today, the advances in equipments, advances in diagnosis, advances in artificial intelligence, which we are seeing in the last 1 year, has been phenomenal. And the whole thing has changed. And once the whole thing system changes, then to adjust to that system, probably our generation who were born in late 1950s have seen the maximum amount of change occurring in the world. From the nowhere to 285 days in space and eating. So I mean, we've probably gone through and adjusted well to it, with the millennial generation, with the X generation, with the Y generation, and now with this AI generation. So robos will do the work. I don't want to see that, but probably it's going to happen. And that's so medical science has advanced to a great extent. We're very, very good in diagnosis now. We are very good in management. We are very good in predicting. So our predictive models have become very good. And picking up genetic disorders, cancers, cancer genes. See, all of us have all bad genes also. We are born with 30,000 genes. Half of them are junk, more than half. And a lot of cancer genes are there in all of us. But it is the epigenetics which is triggering. So we have understood that. And probably we will, and environment care, of course. So I think phenomenal advances, phenomenal. And I see it going to nowhere. I mean, you just imagine. See, 40 years back, if you read the book of Aldous Huxley, The Great New World or something like that,
Yes, yeah, Brave New World.
He described IVF that in the pink broth, the sperm and the egg will be mixed and a baby will be born. My God, I mean, nobody had thought of IVF that time. And now, when you see they're talking of artificial wombs, babies will grow in plastic wombs. You'll be able to see your baby grow. By what I read in research, by 2070, this is going to be a reality.
Yeah.
The sheep have already been born, human beings. So there'll be, and probably we will be using animal wombs also. Maybe a cow's womb, and what the Hinduism said, Gai hamari mata hai, may come true.
Yeah, exactly. No, but I mean, it's true. I think whatever science fiction, and I keep telling this to people, that if humans can imagine it, then we will also actually make it happen, right? So
scientists are crazy. They will do whatever is possible. Now it is up to the society to decide what to let them do.
true.
Because we stopped them at cloning. Otherwise, we would have seen clones all around the world right now. We are seeing cloned animals, which is and cloned Pashmina goat in India. So Pashmina shawls will become cheaper. Shatush will also. so good things will happen. Bad things. If we clone Hitlers, if we clone Mahatma Gandhis, then it will be crazy world back again.
Correct.
And what I heard was that they found a mammoth's blood in a mosquito buried in Alaska. And from that drop of blood which that mosquito bit a mammoth elephant, they're trying to make a mammoth elephant all over again, or a dinosaur all over again. So that things might come true in the next 40, 50 years.
So one of the, I play a prank every April 1st. And one of the pranks we did earliest on was that of the woolly mammoth, the return of the woolly mammoth, and how
the return of the woolly mammoth is coming.
Yeah.
Maybe our generation will not see it, but our grandchildren may see it.
Correct. No, so I think a lot is happening, but I think it also, like many other changes in technology, I think it will also help in making medical care better, because I think the number of doctors we have today are still lesser than the number of people we need.
Absolutely right.
So I think that's one thing that needs to change. But I've also heard that, the younger doctors are having a really hard time in just, becoming, earlier, I think you were a doctor, you were treated with great amount of respect and all. Today, I think that is slightly changing, I think, which is sad.
So that's where some trust has been lost. I don't know where, probably because of the money coming in between, because the expensive equipments which the doctors have to purchase, because they start actually the career at the age of 30. By that time, their friend who's done in computer sciences and all is already earning in lakhs. And they start with a salary of 20, 30,000, 40,000. It's luckily 1 lakh now, but even 1 lakh a month for at the age of 30 to start is peanuts, and with the amount of work you have to do and amount of brain and and the patients are getting, they say, I'm paying you, I should be 100% okay. I should not die. I should not get infection. I should not, everything should be smooth. There should be no complication. That's not possible. So somewhere the trust building, and it is also happening because all this technology is not yet reached the village level. So once we are talking of artificial wombs, village, we are still talking about deliveries in the barns or the cow sheds, and right next to you is a cow and you're delivering babies. So that's still happening. And in Asia, Africa, so still we control the maternal mortality, but still it is quite high. Still we have to work a lot on that field.
Usi baat pe, I know one of the most interesting slogans of our day today, the Beti Bachao, Beti Padhao, was something that you coined, I think. So how did this come about, and why did, what made you come up with that?
So 2008, I was elected as the Foxy president, one of the youngest Foxy presidents. I think I was before time. into Foxy because we were working for it a long time. And that time we were working a lot on ultrasound, spreading ultrasound knowledge all over India. So I was traveling a lot. And then we said, and that time we had opened up an NGO also called Smriti, New Levels of Care, and we adopted schools for teaching the girls. And that's where I felt that the girls are not being taught, or they're not going to school and they're dropping out. So I said to say, and a lot of rapes and all were happening at that. That's it. This is 1980s, late 80s and 90s. So I thought maybe if we can educate these girls, they will probably be a bread earner, and they will. So that time I said, what are the problems? So my problem was weep. And that weep is spelled with 4 E's, not with 2 E's. It's not WEEP. It's 4 E's. The first E was education. The second E was her employment after the education. The third E was her environment where she's working, where she's employed. And finally, she gets empowered. So weep, if we can tackle weep in girls, we will be able to have a healthier women. So that's why I said, Beti Bachao, Beti ko padhao pehle. So let's do the first E. So Beti Bachao, Beti Padhao just came one day sitting, and I said, let's Foxy slogan every president has to give. So let me give Beti Bachao, Beti Padhao, Chalo Gaon Chale. And we did a whole India Yatra for months and months. My mother was very sick. She was in the hospital. Still, I went over to some 200, 300 villages. We were called by the President of India. We were honored. 1 full month, a group of 30, 40 Foxians and everyone joining from each city just joined, and we had a mass movement at that time. So Beti Bachao, Beti Padhao came there. Then everyone forgot. And then our Honorable Prime Minister just took it. We are still not acknowledged for bringing it, but it doesn't matter. We are happy that it's a national slogan. But in COVID times, I felt like that we need to add something to it, because betiyan pad gayi hain. Every village has a MA girl or a PhD, or every girl has studied, because they're sitting at home and they're not allowed to work, and still they're facing the same problem of all this sexual harassment and environmental harassment. So we said, add beta samjhao to it. Beti bachao, beti padhao, beta samjhao. So once the male factor understands that this woman is now at your shoulder and she has to walk right next to you, equal to you, once men understand that, I think, and that's the most difficult thing to do. To make men understand is the most difficult thing.
Yeah, but I think, that is, I think, slowly happening, right? Like, I mean, I know that
It is happening, but you saw that yesterday I read the newspaper, this housewife committed suicide with a 4-year child. She said, my husband treats me like a maid. I'm so educated. And before coming suicide, she cooks a food for him. Hey, Gaurav, I'm leaving food for you in the fridge. I mean, see what is happening. So they are educated, they are employed, but they're still not empowered. And that the empowerment has to come. Then only will be a different nation. But unfortunately, it's not even happened in US. Even in
I
US,
agree.
see, they have not had a woman president. They'll never let a woman become a president of USA. They were so, and they will never give the same pay to that woman
Yeah, which is
for
sad.
the same job.
Yeah.
So even the most developed country is facing the same problem. So I think we'll take 100 more years.
I hope not. So, I mean, I see that, like, my dad used to tell the same thing, that, most important is you need financial independence and you need to be able to do what you can. And after that, I think, and the other important choices, who do you marry, right? I think that's the same advice I give my daughters, that who you marry will make a biggest difference in your life. So do that very carefully. So one is to, of course, look at there is genetics, but there's emotion, there's how do they support you? Because if you don't have that, then the rest of it is your emotional stress will completely spoil your health. I think I don't know if there is, from a last in your practice, if you have seen stress playing a big role in terms of health and how that plays out as well.
Major role. First, about marriage. In our times, it was very easy to get married and very difficult to separate. Today, it is the old time. It's very difficult to get married and very easy to separate. They're separating after 1 month of marriage. And they've been friends for years. I said, what is happening? I mean, you know each other for 10 years. You still want to separate after only just 1 month? No, he is not the same guy who he was before we got married. Or she is not the same girl who. So the girlfriend. So my mantra to these youngsters is to treat your spouse as a girlfriend, boyfriend forever. Don't treat them like a wife. Keep on giving that red rose every day if you have to. Even when you are 20 years, 40 years married, yeah, I've got one, I'll just send it to Jaideep when I come to my office after being married for 44 years. So that keeps the spark alive.
Correct.
And these guys are just busy on their laptops, no time for emotional talk, no time to communicate, no time for sex, no time for planning anything, nothing. And the life is getting stressed and stressed and stressed. So your question, stress, yes, stress affects this couples a lot. Firstly, they're not getting married at the right time, and they are only running after career and money. So that important part aspect of planning a family is gone out of their timetable. And once they wake up at 35, now I should have a child, then it is too late. And then they'll run to the doctors for IVF and all the IUIs and all the complex treatments, and they get more stressed. So the emotional breakdown happens in both of them. They separate or they fight. Finally, they get a baby. Then how to look after the baby, because now again the career starts all over again. So it's a very I mean, the advancement has taken. So women, and unfortunately, it's the women. Men can't have babies, so it's the woman who has to plan her career, her family, her baby. So she has multiple roles, and only she can do it. And we salute you all for doing that. We can only help you all if the man is understanding. So I think the stress is there. And for us, the stress is, I do a difficult operation, I come back and I'm like, oh my God, I've saved a life. Will she be okay? Will she get infection? Tomorrow, will she bleed again? So that stress and blood pressure goes. And someone asked me, do you measure your blood pressure? I said, yes, before and after operation. And it's always 10 degrees higher after operation. And even if it is a successful operation, with happiness, it is higher.
Correct. But Ajkal, there is also that band that you can use to
Yeah,
get,
yeah.
the,
So these
no, there's
smart bands and smart watches
yeah,
tell you what is happening to you,
correct.
how
And
much you're sleeping, how much you're snoring, how much everything it tells you. No privacy left.
yeah, and you can share that information with your doctor as well. But so I think, when we are talking about women getting pregnant late and all of that, I think genetics maybe there is a effect, right? Like in
Absolutely,
terms of,
yes.
so what are the kinds of genetic testing that you typically would recommend? One, we discussed it, of course, women need to have their career, but then you also need to get the career screening done as well, right? So along with their career, I think they need to do the screening. But other than career screening, which is testing for if there's any recessive conditions or anything, and you can look for more than 6,000 such things. So does that affect their genetics in any way? And what are the typical tests that you recommend that they do in those cases? What are the
So
other
first
tests
thing is,
that you...
when women get married late, we have to remember that women have a fixed amount of eggs in them. God has given them two ovaries with fixed amount of some 400,000 eggs, which every cycle they're going to lose 200-300 for one to ovulate. And women get married late and plan a pregnancy late, they're going to get difficulty in getting pregnant. If they get pregnant, they'll have a lot of medical disorders like blood pressure, diabetes, preeclampsia, and then they'll have a higher chance of getting a genetic abnormality. And these the common three genetic abnormalities which come with higher age is Down syndrome, Patau syndrome, Edward syndrome. That is 13, 18, 21 chromosomes. The other chromosome abnormalities, if it happens, they will abort. So we are not too worried about. But if it keeps on happening repeatedly, then of course they have to get a lot of tests. So we would recommend for late marriages and late conceptions that both husband and wife should have a karyotype done. So we know that their genes are normal. Even with normal genes, they still can have problems, or they may be carrying genes for diseases like thalassemia, sickle cell disease, Tay-Sachs disease, cystic fibrosis. these are rare diseases in utero, which we call, they're not so rare now. And so they need to be screened for those. And there are screening tests available for those. Now, if they don't get screening tests, then of course, and then they should go to a doctor for counseling on getting the best baby out with the best outcome without a genetic abnormality. So that's where the doctor will emotionally plan them, nutritionally plan them, and give supplements or whatever, and then of course ask for these tests. Now, supposing they don't come for them, come to you as pregnant. Now, when they come to you as pregnant, then also we have tests within the first 3 months of pregnancy, which are known as screening tests, which are biochemical. But now we have a better test, which is NIPS, or non-invasive prenatal diagnosis and screening, which is done from the mother's blood. And previously, it used to detect only 5 chromosomes. Now we have the extended NIPS and the CNQ sequencing of the genome. So it can pick up 22 types of microdeletions and the various syndromes and all, which that baby might be having. And then you can go for an invasive test and decide on what. So genetic testing is a reality, is available, is not very expensive now, is available practically everywhere in 2-tier cities. Even in 3-tier cities, the sample can be collected and sent, and the report can be there in 4 or 5 days there. Now, there's another scenario where this older couple is coming to you and not being able to get pregnant with trying. So they are going to go for IVF. Now, older IVF patients will have older eggs, and the older eggs, or the older eggs, especially in women, are more likely to be aneuploidic eggs, and not euploidy. Euploidy means normal, aneuploidy means they have some chromosomal defect. Because these eggs were, as I told you, made when the fetus, when they were in their mother's womb at 20 weeks. So it's a long-standing egg, and it is going to be genetically abnormal a lot of times. So that is where on this egg, when we make an embryo with IVF, we can do pre-implantation genetic testing, and we take a biopsy of that embryo. There are 20 embryos. We take all the biopsies, whichever are normal, they are left, the rest are discarded or sent for research, and we put in the normal embryo, so we get a normal pregnancy. And then, of course, the latest advances would be gene manipulation, CRISPR, changing the genes into the embryo, treating diabetes, treating diseases inside the embryonic level. Those are research and will probably be available to us in a couple of 20 years or so, I think. They're coming very fast.
I think there was some Chinese
Yeah.
a couple that was, I mean, babies, twin babies that were already created that way. But I think there's a lot of
Designer babies are coming. We can make your babies with blue eyes. All those things are being tried, and a superhuman, genetic-free human, a muscular, a more intelligent baby. So probably in future, the generations would be, these ones will go in the army, these ones will be scientists, these ones will be doctors. So they'll get that type of gene edited in them. Maybe that might happen one day.
I think there is a movie Gattaca that is there in the, I think, late 90s or something like that. And I think the first thing that they mention in that movie is that a single drop of blood or a single drop of saliva can determine who you are. But I think in the end, there are things beyond that is there in your genetic code. I think the epigenetics, your grit, your
Yes,
resilience,
that is very important.
which people can also used to be. And I think the movie also showed that they had some system where certain people could only become certain kinds of professions, but ultimately I think maybe that's a more advanced caste system in some form, but I think they showed that a human spirit ultimately wins, and so if you have the will, you are able to be able to surpass any of systems like that as well.
So
So
there's a
anyway, I
lovely
think that
novel by Jeffrey Archer, The Second Twin, and where with IVF they make 8 different, they clone one embryo into 8 absolutely similar, and they put all those 8 babies with different people, one with the thief, one within the army, the parents, and how epigenetic, one in the doctor's house, one in the lawyer's house, and one in, so they all 8 babies were genetically 100% same and looking same in everything. Still, they turn out to be 8 different individuals. So it's not only the genetics, it's how your environment is, how your upbringing is, how all that. So your epigenetics, what air you're breathing, what you're listening, what you're this thing. And then again, we talk of spirituality. We may be able to clone, but can we clone souls? So the God or whoever the force is, he is probably looking down and laughing at us humans that we are looking into the dark secrets of nature, and he laughs at the giddy turns which we humans are taking, and we don't know where we go. So as Horace said, we cannot duplicate souls. The soul is probably there, probably there.
तो अगर हिंदी में आपको एपिजेनेटिक समझाना हो किसी को, यू नो
सो
ऑब्वियसली इंग्लिश
एपिजेनेटिक्स
में
क्या
तो
है आपके अंदर? हाँ,
हम
सबके लिए आपके अंदर सेल्स हैं, उसमें क्रोमोसोम्स है, 46 क्रोमोसोम होते हैं। अगर आप मेल हैं तो आपके अंदर एक एक्स वाई है, फीमेल के अंदर एक्स एक्स है। बाकी 22 पेयर ऑफ क्रोमोसोम्स आपकी बॉडी कैसी शक्ल है, बाल कैसे है, सब कंट्रोल करते हैं। हर क्रोमोसोम पे जीन्स होते हैं। हमारे अंदर 30,000 से ऊपर, 40,000 के करीब जीन्स है, और ज्यादातर ये जीन्स जंक है, जो कुछ काम करते, बेकार जीन्स है। इसमें अच्छे जीन्स हैं, बुरे जीन्स हैं, कैंसर के जीन्स हैं, डायबिटीज की सबके अंदर सब जीन्स है। अभी आपको सबको कैंसर होता नहीं, सबको डायबिटीज होती नहीं, सब लोग को चश्मा लगता नहीं, तो क्यों नहीं लगता जब हमारे अंदर सबके अंदर जीन्स है? तो जिस एनवायरनमेंट में हम, जिस परिस्थितियों में रह रहे हैं, हम जिस माहौल में रह रहे हैं, स्ट्रेस है, जो हम खान पीन खाते हैं, योगा मेडिटेशन नहीं करते हैं, सूरज की धूप से जल रहे हैं, अपनी स्किन को जला रहे हैं, सनस्क्रीन नहीं यूज करते, विटामिन डी नहीं है, फोलिक एसिड नहीं है हमारी डाइट में, ये सब जो है आपके अंदर की खराब जीन्स को, जब ये खराब जीन्स स्मोकिंग करते हैं, अल्कोहल पी रहे हैं, हुक्का शीशा जो बच्चे कर रहे हैं, तो ये सारे फैक्टर्स आपकी बॉडी सुस्त हो जाएगी, थकान होएगी, आंखों से दिखाई नहीं देगा, कान से सुनाई नहीं देगा, टेस्ट चला जाएगा, खाना हजम नहीं होगा, जगह जगह फोड़े फुंसी होंगे, कैंसर की ग्रोथ होंगी, सिस्ट बनेंगी, रसौली बनेंगी। तो ये सब एपिजेनेटिक्स है। सो हम जिस जिस माहौल में रह रहे हैं वो एपिजेनेटिक्स है, और हम जीन है। सो ये ट्रिगर है, स्विच और प्लग है। तो वो स्विच आपके हाथ में, एपिजेनेटिक्स। आप अपने एपिजेनेटिक्स को स्वस्थ जीवन से बिताएं, और देखिए आप बिल्कुल हेल्दी रहेंगे, लॉन्ग लॉन्ग। बुढ़े नहीं, किसी को झुर्रियां जल्दी आ जाती हैं, कोई बुढ़े हो जाते हैं 40 साल में। क्यों? हम लोग सब एक से ही है ना। पर कोई 40 साल में सारे बाल सफेद हो जाते हैं और बिल्कुल बुढ़ापा आ जाता है, और कोई 70 साल मेरे जैसा अभी तक बूढ़ा नहीं लग रहा हूँ, आई होप सो। सो सो कुछ कुछ आपको अपनी बॉडी पे कंट्रोल, अपने एपिजेनेटिक्स पे करेंगे, तभी आप लॉन्गेटिविटी रहेगी। तो लॉन्गेविटी जेनेटिक्स भी है और एपिजेनेटिक्स भी है।
बिल्कुल, क्योंकि जेनेटिक्स तो आपके जो हाथ में आया
वो
है
तो बदल नहीं
तो
सकते आप।
वो आप बदल नहीं सकते हो। बट एपिजेनेटिक्स या मतलब लाइफस्टाइल के द्वारा, लाइक जैसे आपने समझाया वैसे हम बदल सकते हैं, एंड उससे आउटकम अच्छा रहता है। तो मैं हमेशा कहती हूँ कि एक तो होता है कि अपना जेनेटिक्स है जो जो कांस्टेंट है, जो हम मिल गया वो मिल गया। फिर अपनी हैबिट्स है जिससे एपिजेनेटिक्स के काफी फर्क पड़ता है, और एक डॉक्टर की भी बहुत जरूर इम्पोर्टेंट है, क्योंकि वही हमें गाइड करते हैं कि क्या करना चाहिए उसके बाद में। तो ये तीनों अगर जब किसी के पास हो तो उनका जीवन लंबा और स्वस्थ रहता है। सो सो आपने कहा कि टेस्टिंग के लिए स्पेशली जो ओल्डर लेडीज है उनके लिए ज्यादा जेनेटिक एबनॉर्मेलिटीज होने के चांसेस है, एंड इसलिए उनको ये सोचना चाहिए कि क्या पॉसिबिलिटीज है, और अगर मतलब प्रेगनेंसी लेट करनी है तो क्या चॉइसेस है उनके पास। तो आप और एक मुझे एक सवाल था कि ये कॉम्प्लिकेशंस जो आते हैं, क्या आजकल लोग वो एग्स जो है वो फर्टिलाइज जल्दी करते हैं या नहीं कर रहे हैं अभी तक? मतलब वो
तो
सेव करते हैं ना एग बैंक, वो जो
हाँ,
आजकल बट वो फ्रीज करते हैं।
फर्टिलिटी कंजर्वेशन और एग फ्रीजिंग। अभी अगर आप लेट मैरिज कर रहे हैं तो अपनी जेनेटिक कुंडली, अपनी मैरिटल कुंडली जरूर मैच करिए। ये मैं नहीं कह रहा कि अगर मैच नहीं हो रही तो शादी तोड़ दीजिए, बट उससे आपको गाइड बहुत मिल जाएगा। क्योंकि देखिए, छोटी छोटी चीज, RH नेगेटिव खून हो सकता है, थैलेसीमिया कैरियर हो सकते हैं। अगर दोनों लोग थैलेसीमिया कैरियर हो गए तो आपके आधे से ज्यादा बच्चे थैलेसीमिक होंगे, जिनको बहुत खून की जरूरत होगी, और वो फिर जल्दी मर जाएंगे। तो वो प्लानिंग हो सकती है, उसमें प्री इम्प्लांटेशन जेनेटिक यूज कर सकते हैं। सो टे सेक्स डिजीज है, एकॉन्ड्रोप्लेजिया, बहुत सारी बीमारियां ऐसी हैं जो अंदर छिपी हुई हैं, तो इनका पता लगा, तो कैरियर स्क्रीनिंग जरूर करानी चाहिए। बच्चा क्या पैदा होते ही उसकी जेनेटिक स्क्रीनिंग, न्यूबॉर्न स्क्रीनिंग टेस्ट करके आता है, जो 26 बीमारियों के एक बूंद खून से पता लग जाते हैं, वो जरूर कराना चाहिए, जिससे आगे चल के उसको उसको अगर है भी बीमारी तो उसको कंट्रोल किया जाए। फिर जब आप ओल्ड है, अगर आप महिला हैं और आपने शादी नहीं करनी, आपने ठान लिया है मेरे को इस कंपनी का सीईओ बनना है, जो मैं 40 साल की उम्र से कम में नहीं बन सकती, तो मेरे को 40 साल सिर्फ काम करना है, शायद मैं बीच में शादी कर लूं पर बच्चा बिल्कुल नहीं करूंगी, तो शादी भी नहीं करूंगी, ये भी बहुत लड़कियों में आजकल है। सो व्हाट इन आर आर टाइम्स वाज 25 पे शादी, 27 पे बच्चा, 30 पे दूसरा बच्चा, हैप्पी फैमिली, काम करो उसके बाद। वो आइडियल सिचुएशन है फॉर ऑल विमेन। थोड़ी देर कैरियर को ब्रेक दे दीजिए शुरू में, उसके बाद कैरियर वापस आ जाएगा, पर बच्चा नहीं होने का वो वापस नहीं आएगा टाइम। सो अगर आप 30 पे आपकी फर्टिलिटी ऐसे गिरने लगती है, और 35 के बाद तो बहुत तेजी से गिरती है। सो अगर आप नहीं भी कर रहे हैं, आपने डिसाइड किया 30 साल की उम्र पे मेरे को अभी शादी नहीं करनी, तो महिलाओं को अपने एग्स को फ्रीज, क्योंकि महिला में जैसे मैंने बताया एक फिक्स नंबर ऑफ भगवान ने अंडे दिए, जो कि हर माहवारी साइकिल पे खत्म होते जाएंगे, और खत्म 300 हर हर महीने खत्म होंगे, तो आपके 40,000 अंडे आपके 35 साल पे खत्म हो जाएंगे। सो आप अपने डॉक्टर के पास जाइए जो आईवीएफ स्पेशलिस्ट है आपके पास, और उसको कहिए मेरे को अपनी फर्टिलिटी प्रिजर्व करनी, तो कुछ दवाई देगा, ओमेगा 3 एसिड्स और कुछ डीएचसीए और कुछ हॉर्मोन्स, जिससे आपके अंडे बचे रहें, और एडवाइस होगी कि आप दवाई लेके अंडे बना के उन अंडों को निकलवा के एग फ्रीज कर दें। सो वो एग्स आपके 20 साल तक फ्रीज करके रख सकते हैं। अगर आप शादी हो गई है और बच्चा नहीं चाहते हो, तो फिर एम्ब्रियो फ्रीज करते हैं, तो हस्बैंड का सीमेन लेके उनके एम्ब्रियो बना के, भ्रूण बना के उसको फ्रीज करते हैं। पर वो भी कई कपल्स नहीं करा रहे, क्योंकि वो कहते हैं पता नहीं हमारा डाइवोर्स ही हो जाए, जो कि बहुत कॉमन है आजकल। तो इसलिए एग फ्रीज के लिए ज्यादा आ रही है, और बहुत महंगा नहीं है, बहुत मुश्किल नहीं है। गूगल फेसबुक जैसी कंपनीज ने तो लड़कियों को कहा है तुम यहाँ काम कर रही हो, एग्स फ्रीज का हम खर्चा देंगे, शादी मत करना 35 साल तक। सो उसके बाद तुम लोग बच्चा कर लें, 35 साल के बाद तो वो वैसे ही निकाल देते हैं, क्योंकि दे वांट यंग ब्लड, enthusiastic blood in their companies. So that is a very, very good option for girls, women who are not planning to get married and who are not planning to have children. Egg freezing and embryo freezing is better if you are married. अगर आपको कोई ऐसी बीमारी हो गई है लाइक एंडोमेट्रियोसिस, फाइब्रॉइड्स, ओवेरियन सिस्ट, पॉलीसिस्टिक ओवेरियन डिजीज, कैंसर्स, हस्बैंड को कैंसर है, तो भी ये फर्टिलिटी को आप प्रिजर्व कर सकते हैं। कैंसर का ट्रीटमेंट लीजिए, बीमारी ठीक करिए, आपके अंडे हमारे पास पड़े, बच्चा आपको हो जाएगा इवन आफ्टर कैंसर। सो फर्टिलिटी प्रिजर्वेशन इज अ ग्रेट ब्रेक थ्रू, और बहुत इजी हो गया विद रैपिड फ्रीजिंग। बड़े बड़े फ्रीजर में बच्चों को 20-20, 25-25 साल तक स्टोर कर सकते हैं, और 20 साल के बाद भी आप, और एक ही बार एग्स देने से 2 या 3 बच्चे के लिए आप प्लान हो सकता है। सो पहली बार में आपने एक किया, फिर 2 साल बाद आके दूसरा भी कर लिया, तो दैट इज अ वेरी वेरी गुड ऑप्शन, विच अगेन अवेयरनेस नहीं है इसकी, क्योंकि लोग सोचते हैं बहुत महंगा होगा, और मैं क्यों, मैं तो ऐसे ही हो जाते हैं बच्चे, मेरी माँ के तो 40 पे हो गए थे, मेरी दादी ने तो 40 पे करे थे, तो वो अब जमाना खत्म हो गया, वो नहीं है अब, एपिजेनेटिक्स बहुत खराब है।
हाँ, क्योंकि आई थिंक जो एक व्हाट इज ट्रू फॉर वन पर्सन इज नॉट नेसेसरली ट्रू फॉर,
नॉट ट्रू।
तो आई थिंक हर एक का जेनेटिक्स अलग होता है, एपिजेनेटिक्स अलग होता है, तो हर एक को ये सोचना चाहिए कि व्हाट इज राइट फॉर मी, व्हाट मे बी माय ग्रैंड मदर डिड वाज अ डिफरेंट टाइम। वो काफी एक्टिव रहती होगी उस समय मदर के टाइम में। सो आई थिंक थिंग्स हैव चेंज, लाइक यू सेड, एपिजेनेटिक्स हैज चेंज अ लॉट फॉर ऑल ऑफ अस, राइट? लेकिन आपने क्या कभी ये देखा है कि ये पीसीओएस फाइब्रॉइड्स जो आपने अभी अभी कहा, वो क्या ज्यादा बढ़ गए हैं क्या आजकल, या डिटेक्शन ज्यादा हो गया है?
सो प्रॉबेबली तो डिटेक्शन ज्यादा हुआ है, प्रॉबेबली भी, पर बढ़ भी गए हैं, क्योंकि लाइफस्टाइल चेंज हुई है, ये सब लाइफस्टाइल डिजीजेज है, स्पेशली पॉलिसिस्टिक ओवेरियन सिंड्रोम, पीसीओएस। ये देखा गया है कि हर 15 से 20, 25% महिला लड़कियों में एडोलेसेंट पीरियड स्टार्ट होते हैं, फिर 2-2 महीने पे नहीं आते, मोटापा आ रहा है, चेहरे पे मुहासे आ गए, बाल आ गए, यहाँ काले निशान आ गए गले के, पेट बढ़ गया है, मोटा होते जा रहे हैं। तो ये लाइफस्टाइल, जो खान पीन सही नहीं है, एक्सरसाइज नहीं करती हैं, क्योंकि पीसीओएस की जीन्स भी इन सभी लड़कियों में है, और वो जीन्स एक्टिवेट हो जाती है तो फिर, और पीसीओएस जब हो जाएगा आपको तो अंडा नहीं बनेगा, अंडा नहीं बनेगा तो माहवारी बिगड़ जाएगी, माहवारी बिगड़ जाएगी तो और सारी बीमारियां यूट्रस की, और इरेगुलर पीरियड्स, हैवी मेंस्ट्रुअल ब्लीडिंग, एंडोमेट्रियल हाइपरप्लेजिया, ये सब, तो इन सब का इलाज डॉक्टर से कराना बहुत जरूरी है। नहीं कहना कि 12 साल पे, अरे ये तो अभी बच्ची है, मोटी हो रही है, तो क्या हो गया। अगर मोटापा आ रहा है जल्दी और मुहासे ज्यादा आ रहे हैं, तो प्लीज डॉक्टर से मिलिए और जांच कराइए, और उसका इलाज सरल है। पहला इलाज तो सबसे लाइफस्टाइल बदल दो, सब ठीक हो जाता है। नहीं तो थोड़ी बहुत मेडिसिन देने से ये इम्प्रूव हो जाता है। अदरवाइज ये लॉन्ग टर्म में जाके ओल्ड एज करेगा, हार्ट हार्ट की बीमारी करेगा, डायबिटीज टाइप 2 करेगा, मेटाबॉलिक सिंड्रोम करेगा। आपकी बॉडी 40 पे बिल्कुल आप एक टोटल यूजलेस ह्यूमन बीइंग बन जाएंगे, फुल ब्लोन मेटाबॉलिक सिंड्रोम अगर हो गया तो।
तो जैसे आजकल जब छोटी लड़कियां जब 15-16 इयर्स की हो जाती है तो मोस्टली डर्मेटोलॉजिस्ट के पास जाती है, बट दे शुड एक्चुअली गो टू सी अ
गो टू
गायनेको
अ गायनेको।
बिकॉज
डर्मेटोलॉजिस्ट क्या करेगा, डर्मेटोलॉजिस्ट लोकल उस पर लेजर कर देगा, तो उनको बाल को लेजर से हटा देगा। बट पीछे ये फिर से आ जाएंगे ना, तो
रूट
पीछे की
कॉज पता करना
फिजियोलॉजी समझना जरूरी है, पैथोलॉजी, और उसको ट्रीट करना चाहिए। इंसुलिन रेजिस्टेंस हो रहा है आपको, आपके हार्मोन्स गड़बड़ हो रहे हैं, तो थोड़ा बहुत हार्मोन लेना, प्रोलैक्टिन हाई हो रहा है, थायराइड हाई हो रहा है, तो डर्मेटोलॉजिस्ट तो एक स्किन स्पेशलिस्ट खटाखट स्किन करके आपको उस दिन यू आर लुकिंग वेरी ब्यूटीफुल, पर 20 दिन बाद फिर वो प्रॉब्लम होगी। तो वो कराना भी जरूरी है, बिकॉज वो इमीडिएट सेल्फ कॉन्फिडेंस देता है, क्योंकि दवाइयों को लगेगा 3-4 महीने काम करने के। सो आजकल आप देख रहे हैं कई सारे गायनेकोलॉजिस्ट ने डर्मेटोलॉजी का सेक्शन अपने साथ ही खोल लिया है। अभी हमारे पास भी ये बाहर जो रूम है उसमें कॉस्मेटोलॉजी सेक्शन पूरा है, बिकॉज अ गर्ल, आई एम ट्रीटिंग अ वुमेन एज अ होल। आई स्टार्ट हर ऑन हॉर्मोन्स, बट वो इमीडिएट इफेक्ट आएगा नहीं। गो टू द कॉस्मेटोलॉजी, गेट योर हेयर रिमूव्ड, गेट योर एक्नी ट्रीटेड, गेट योर फेस ग्लो डन, इमीडिएट यू सेल्फ कॉन्फिडेंस, देन यू आर रेडी टू, देन आपको बिलीव होएगा कि ट्रीटमेंट काम करेगी। सो दैट इज, बोथ आर इम्पोर्टेंट।
both are needed, not just one or the other.
नॉट ओनली सिर्फ कॉस्मेटोलॉजी कराने से नहीं होगा,
ठीक है।
जड़ पे पहुंचना बीमारी की जरूरी है।
तो आपने ये भी देखा होगा कि बहुत सारी लड़कियां एंड यंग अडल्ट्स कि वो आजकल बहुत सारे अलग अलग डाइट्स पे फिदा हो जाते हैं, कभी ये किया कभी वो किया। अ, तो क्योंकि हर एक की जेनेटिक्स अलग होती है, अलग मतलब प्रोटीन्स अलग से मेटाबोलाइज करते हैं, कार्बोहाइड्रेट्स अलग करते हैं, लेकिन सब लोग एक कोई सेलिब्रिटी या इन्फ्लुएंसर को देख के वो डाइट्स चेंज करते हैं। तो आप क्या उनको सलाह देंगे या क्या एडवाइस देंगे उनको?
तो देखिए, हमारी बॉडी को 3 मेन आहार चाहिए, कार्बोहाइड्रेट, प्रोटीन और फैट, और संतुलित आहार उसमें मात्रा में चाहिए, तीनों चीज चाहिए। और बहुत सारे न्यूट्रिएंट चाहिए, आयरन, कैल्शियम, जिंक, सेलेनियम, ये सब चीजें, माइक्रो न्यूट्रिएंट सब चाहिए। तो ये सब हमारी डाइट में होने चाहिए। तो आप अच्छी, पहले तो अच्छी डाइट लोगे तो आपको कोई भी फास्टिंग डाइट वाइट कुछ नहीं करनी पड़ेगी। सो अब आ गई डाइट्स। अगर आपको वेट लॉस करना है तो वेट लॉस डाइट्स, जिसमें एक जो बहुत फेमस हुई है कीटो डाइट। कीटो डाइट में क्या किया इन्होंने, कार्बोहाइड्रेट हटा ही दिया। सो आपको कार्बोहाइड्रेट खाना ही नहीं। अब आप कार्बोहाइड्रेट नहीं खाएंगे तो आपके सेल को एनर्जी कहाँ से मिलेगी। सेल को ऑन करने के लिए, बैटरी ऑन करने के लिए इमीडिएट एनर्जी चाहिए, और वो शुगर या कार्बोहाइड्रेट में है। सो कार्बोहाइड्रेट जरूरी। अभी आप सिंपल कार्बोहाइड्रेट ना खाएं, बट कॉम्प्लेक्स कार्बोहाइड्रेट पे आ जाइए अगर आपने डाइटिंग करनी है। कॉम्प्लेक्स कार्बोहाइड्रेट क्या होता है, जैसे कि शकरकंदी, स्वीट पीज, बनानास, केला, इनमें शुगर भी है, पर ये डायबिटीज नहीं करते, और ये वेट लॉस में मदद करते हैं, तो इनसे वेट गेन नहीं होता। आटा, चावल, आलू, इन सब से वेट गेन होएगा। ये सिंपल कार्बोहाइड्रेट है जो सीधे सेल में जाते हैं, जितना काम आता है वो, बाकी लिवर इनको फैट में बना के आपको फैट बना देता है। सो एक तो संतुलित डाइट, फिर एक बार में बहुत ज्यादा नहीं खाना है। सो अभी जो 3 बार खाने की, एक तरह की डाइट है कि 3 बार खाने की जगह आप 5 बार में डिवाइड कर ली। सो मिड मॉर्निंग स्नैक 11 बजे बहुत जरूरी है, मिड इवनिंग स्नैक 5 बजे बहुत जरूरी है, अर्ली डिनर बहुत जरूरी है, और थोड़ा सा लेट ब्रेकफास्ट। तो
द टाइम।
कीटो डाइट हो गई एक, एक ये 5-2 डाइट हो गई, 5 मील्स की डाइट हो। तीसरी डाइट है इंटरमिटेंट फास्टिंग, जो कि बहुत फेमस हुई है बिकॉज सारी सेलिब्रिटीज ने। सो दिस इज गुड फॉर वेट लॉस, इट विल मेक यू वेट लॉस, बट इट विल ऑल्सो कॉज यू टायर्डनेस एंड फैटीग। सो आप सुबह सुबह काम करने वाले अगर आदमी हो या जो भी पुरुष हो, तो आपको दिक्कत होगी, क्योंकि आपको हम कहते हैं कि 8 बजे रात को या 7 बजे डिनर खत्म, और 11 या 12 बजे ब्रेकफास्ट, तो आप 16 घंटे फास्टिंग रह रहे हैं। उसमें से 8-9 घंटे तो सोते हुए निकल जाता है, इजी है। बट अगर आप सुबह उठते ही काम पे जाना है, स्पेशली डॉक्टर्स को जो ऑपरेटिव करनी है, स्पेशली कंप्यूटर्स वालों को, या स्पेशली जो ब्रेन, सो योर ब्रेन नीड्स एनर्जी, कार्बोहाइड्रेट। अगर ब्रेन के पास एनर्जी नहीं है तो ब्रेन स्लीपी होएगा, सो उससे फटीग और स्लीपनेस होती है। वेट लॉस होएगा उससे, वेट लॉस तीनों से होएगा। सो माई एडवाइस इज टू टेक अ बैलेंस डाइट, एंड इंस्टेड ऑफ 3 टेक 5 मील्स। टेक 5 मील, ईट एवरीथिंग यू वांट, डोंट, फैट भी उतना जरूरी। और रात में या खाने के बाद स्वीट डिश नहीं खाना है। स्वीट डिश, अब कार्बोहाइड्रेट अगर आपका लास्ट जाएगा अंदर, तो आपको और खाने की क्रेविंग होगी, भूख जल्दी लगेगी। सो लास्ट में आपने क्या करना है, 1 चम्मच भर के घर का निकला मक्खन या देसी घी सादा पीना है। फैट विल गिव यू तृप्ति। फैट से एकदम 1 चम्मच फैट जाते ही भूख खत्म, और भूख खत्म तो आप और खाएंगे नहीं, और 8 घंटे आराम से रहेंगे। सो माई दिस थिंग इज 5, अदरवाइज कीटो डाइट हु कैन टॉलरेट, इंटरमिटेंट फास्टिंग इज गुड, एंड 5-2 डाइट इज गुड। सो 3-4 डाइट है, ये सब ट्राई कर सकते हैं।
एंड
पर
आई थिंक
बिल्कुल फास्ट नहीं करिए, जीरो फिगर के लिए आप कुछ भी नहीं खाएंगे, आप एनोरेक्सिया हो जाएगा, बीमार पड़ जाएंगे आप, तो वो ध्यान रखना।
स्पेशली जो बहुत यंग बच्चे हैं उनके लिए आई थिंक इट इज वेरी इंपॉर्टेंट दैट दे आल्सो हैव कार्बोहाइड्रेट्स एंड एवरीथिंग, बट सबकी अलग अलग सेंसिटिविटीज होती है।
ऑब्वियसली यस।
सो
कोई
जेनेटिक
कहता है मैं सिर्फ, मैं कुछ खाता ही नहीं, पानी पीता हूँ फिर भी मोटा हो रहा हूँ, ये ऐसे तो ये सब, मोटापा होना भी जीन्स में है, उसको
करेक्ट।
एपिजेनेटिक्स से कंट्रोल करिए।
सो वही वही आई थिंक लोगों को वो पता कर सकते हैं कि कौन सी चीज उनके लिए क्या
यस।
बेहतर हो सकती है, एंड देन बेस्ड ऑन दैट दे कैन चेंज देयर देयर डाइट अकॉर्डिंगली।
और इसके भी जेनेटिक टेस्ट हैं, इसके भी जेनेटिक टेस्ट आपके सलाइवा से होल जीनोम सीक्वेंस कर सकते हैं, आपको कौन सी बीमारी कब लगेगी। ये मैप्यो जीनोम सब 10-20 हज़ार में ही कर देंगे ये टेस्ट, और और मे बी लिटिल मोर, एंड
लेस
बट
लेस
इट इज
तो
स्कैरी।
या
इट इज स्कैरी।
या
इट इज स्कैरी टू गेट अ होल जीनोम टेस्टिंग, कि मेरे को अभी अपनी जेनेटिक बीमारियां पता है, कब मैं अंधा होऊंगा, कब मैं मरूंगा, कब मेरे को क्या बीमारी
नहीं
होगी,
नहीं ऐसे
प्रॉब्ली
ऐसे
सम टेस्ट लेंगे।
इसमें इसमें कोई हम अलग अलग टाइप की टेस्टिंग कर सकते हैं। एक तो होती है जिसमें हम सिर्फ जैसे फूड सेंसिटिविटीज हो या विटामिन
वो बहुत
डेफिशिएंसी।
जरूरी है।
हाँ। और आज हमने एक स्टडी भी की थी अभी बहुत अच्छे जर्नल में, नेचर में, कि लोग लंबी उम्र के लिए कौन से जीन्स के वेरिएंट्स हैं। तो उसके लिए आपके टीलोमियर लेंथ हो या फिर वो सब हमने चेक किया है, टेस्ट किया है। तो जिनको बीमारियों के बारे में नहीं पता करना है उनको नहीं चाहिए, दे डोंट हैव टू। बट आई थिंक इट्स इम्पोर्टेंट टू फिगर आउट कि आपकी जेनेटिक्स क्या है, ताकि
स्पेशली
आप
कैंसर, स्पेशली कैंसर स्क्रीनिंग, आई थिंक, जैसे ब्रेस्ट कैंसर, ओवेरियन कैंसर। अब उसने फिल्म स्टार यूएसए में एंजेला जोली ने कराया, उसको उसको ये आया टेस्ट में कि उसको ब्रेस्ट कैंसर होगा। उसने अपने दोनों ब्रेस्ट निकलवा दिए, दोनों ओवरी निकलवा दी, हॉर्मोन्स पे है, आर्टिफिशियल ब्रेस्ट बनवा के। सो आई मीन एक्सट्रीम्स भी होते हैं, बट
but I think most people don't have to do extremes. So I
यस,
think
इट इज
yeah,
नॉट फॉर ऑल।
yeah.
इट इज नॉट फॉर ऑल, ओनली
और
अगर आप हाई रिस्क हैं, आपकी फैमिली में है, तभी कराइए।
बिल्कुल बिल्कुल। और हम ये कहते हैं लोगों को कि यू फाइंड आउट व्हेन यू फिक्स योर डाइट एंड योर न्यूट्रिशन, बिकॉज उसी से काफी सारी बीमारियां भी सेव हो जाएगी आपकी, डायबिटीज हो, हार्ट रिलेटेड प्रॉब्लम्स हो, कैंसर भी आजकल बोल रहे हैं कि इज अ मेटाबॉलिक डिजीज।
Metabolic and probiotics in your diet, prebiotics in your diet, good bacteria living inside you will help your
हाँ
life
बिल्कुल।
improve.
तो एक और आपने इसे बैक्टीरिया के बारे में कहा, तो गट माइक्रोबायोम के बारे में भी आप, आई थिंक, आई डोंट
तो
नो आप यूज
गट
करते हो या नहीं।
माइक्रोबायोम के बारे में भी हम लोग ने बहुत स्टडी करी है, और अभी मेरा कल यूपी कॉन्फ्रेंस है, उसमें लेक्चर भी प्रीबायोटिक्स एंड प्रोबायोटिक्स पे है। सो जो हम हैं, हम लाइफ हैं, उतने ही अंदर हमारे अंदर कीटाणु जी रहे हैं।
बिल्कुल।
और हार्ट, यूरिनरी ब्लैडर को छोड़ के सब जगह कीटाणु है, कान में, आंख में, नाक में, मुंह में, नीचे वेजाइना में, सब जगह, स्किन में, बगल में, सब जगह कीटाणु से भरा हुआ है। अब इनमें कीटाणु अच्छे कीटाणु हैं और बुरे कीटाणु हैं। सो ये गुड बैक्टीरिया जो है वो एसिडिक माहौल करते हैं और बैड बैक्टीरिया को मार देते हैं। सो जब हम खाना खाते हैं, अगर हम फर्मेंटेड खाना खाएं, दही है, छाछ है, लस्सी है, कांजी है, जो फर्मेंट करके खाना खाते हैं, तो ये अच्छे बैक्टीरिया लैक्टोबैसिलाई ये हमारे पेट में जाते हैं, और ये जितने भी बुरे बैक्टीरिया और वायरस जो बीमारी करने वाले, टाइफॉइड वाइफॉइड जैसे वाली, इन सबको वहीं मार देते हैं। सो दिस इज नोन एज योर गट माइक्रोबायोम। आपका एक अलग दुनिया है कीटाणुओं की आपकी आंतों के अंदर, गट माइक्रोबायोम, और इस पे बहुत स्टडी हो रही है। और ये अब यूट्रस के अंदर भी पाया गया है, ये पॉलिसिस्टिक ओवरी में भी डिसबायोसिस है, ये महिलाओं के वेजाइना में रहता है, तो जिन महिलाओं को बार बार वेजाइनल इन्फेक्शन वगैरह होता है, और जो महिलाएं अपने वेजाइना के अंदर बीटाडीन, सेवलॉन और एंटीबायोटिक से धोती हैं, वो सब अलाउड नहीं है। नॉर्मल बैक्टीरिया को ग्रो करने दीजिए, तभी वो आपके वेजाइनल हेल्थ को अच्छा रखेंगे, और आपकी फीमेल रिप्रोडक्टिव हेल्थ को पूरा हेल्थ, उसमें बहुत सारी बीमारियां उससे बचेंगी, एंडोमेट्रियोसिस, पीसीओएस, डायबिटीज, हाइपरटेंशन, वाइट डिस्चार्ज, कैंसर, सर्वाइकल इरोजन, इन सब से बचाव होएगा अगर आपका वेजाइनल माइक्रोबायोम या गट माइक्रोबायोम, ये बहुत।
बिल्कुल, आपने एकदम सही कहा, क्योंकि गट माइक्रोबायोम में सिर्फ बैक्टीरिया सिर्फ बुरे ही नहीं होते हैं, अच्छे भी होते हैं एंड
यू विल बी,
इम्पोर्टेंट।
ये एक पूरी नई एक फील्ड है जिसको, और डेफिनेटली यस, आई टेक प्रोबायोटिक्स एंड प्रीबायोटिक्स। पाउडर में आता है, पानी जैसा आता है, कैप्सूल आता है, कुछ भी एक खा लीजिए, नहीं तो अच्छे भर के कटोरा दही खाइए रोज रात में, ये सब गोल डाल के या कुछ ऐसी चीज डाल के, फाइबर फाइबर और दही डाल के खाइए, देखिए आप हेल्दी रहेंगे।
बिल्कुल। आई थिंक तो एक चीज आपने कहा कि बहुत महंगे होते हैं टेस्ट, आजकल बहुत सस्ते हो गए, आई थिंक तो
हाँ, टेस्ट इम्प्रूव हो गए, दिस इज द
सेवन एट
वेरी गुड
थाउजेंड
न्यूज।
में मिल जाते हैं। एंड ऑल्सो आई थिंक गट माइक्रोबायोम की भी टेस्ट हम आजकल कर
यस,
रहे हैं
वो भी कर,
ऑन बोथ गट माइक्रोबायोम एंड ऑल्सो आई थिंक आपने जो कहा वेजाइनल
एंडोमेट्रियल
माइक्रोबायोम और
माइक्रोबायोम।
ओरल माइक्रोबायोम, ये सारे टेस्ट भी कर सकते हैं। तो अब आपको मैं रैपिड फायर राउंड में लेके जाती हूँ।
अरे बाप रे।
सो आप रेडी अभी?
या,
या, ओके। अगर if you were not a doctor, what would you be? I know that your whole family was doctors, but
I probably would have gone into a social media influencer or something. You see, I was an introvert in school, but suddenly in medical college I became an extrovert, a classical Geminian trait, I think. And I actually right now am probably a very huge multitasker. My brain can't be one place. Right now, I can do four, five. I'm talking to you, I can do four, five things together. I'm ordering and seeing patients also, everything. So I could have probably been a multitasker, play sports, play everything. So probably I would have played sports or been a commentator or a news reader or something like that.
so do you play any specific?
Maybe a small time actor also.
I think that with your videos and with all of that, I think you're already doing
Yeah, I
that.
tried, but I have to find a good person to do my YouTubing to get a
Uh,
million hits.
so there are lots of myths around, when people are pregnant and they'll say, ये है तो girl है, ये है तो boy है. Now, other than doing actual uh, testing, can you tell, what
So
is the funniest?
actually, no. Actually, no, you cannot tell. You cannot tell whether a girl is carrying, a female is carrying a boy or a girl. Sometimes first pregnancy से symptoms different होते हैं, then you think ये boy होगा या ये girl होगी. Sometimes your जो पेट पे लीनिया निग्रा जो सेंट्रल लाइन होती है, वो डार्क हो जाती है, एक साइड को ज्यादा दिखती है, देन यू से ये बॉय होगा, लड़की होगा, ये लड़का होगा, बट ये सब सब मिथ्स हैं। कोई साइंटिफिक बेसिस नहीं है, और ये करना भी नहीं चाहिए, और ये इंडिया में अलाउड भी नहीं है बताना भी, और ट्राई टू प्रिडिक्ट पंडित लोग करते हैं, इवन दे शुड फॉल इनटू द पीसीपीएनडीटी कि हाथ
I
देख के। यू नो व्हाट, माय ग्रैंडफादर टाइम पे जब था, व्हाट ही यूज्ड टू डू व्हेन आई वाज यंग, आई थिंक ही डाइड व्हेन आई जस्ट एंटर्ड द मेडिकल कॉलेज। सो ही टोल्ड मी, आई सेड ये लड़का लड़की लोग पूछते हैं आपसे, आई यूज्ड टू सिट विद हिम इन द ओपीडी इवन बिफोर ज्वाइनिंग एमबी। सो ही सेड, सी ये मेरी डायरी है, ये पेशेंट का नाम लिखता हूँ, और मैं यस या नो लिख देता हूँ। तो जब वो लड़ जब आती है और डिलीवर होती है कि आपने तो बोला था लड़की है, तो मैं उल्टा लिख देता हूँ उस पर। सो अगर उसकी लड़की हो गई तो ठीक है, आपने बोला था, ठीक हो गई। अगर वो बोलती नहीं आपने बोला था लड़का, नहीं नहीं मैं डायरी देखता हूँ, डायरी में तो देख लिखा हुआ है। उल्टा लिखते थे वो जो बोलते थे। सो पीपल हैव ट्राइड ऑल सॉर्ट्स ऑफ थिंग्स, बट आई डोंट थिंक इट
50%
वर्क्स।
probability, right? Yeah,
आधो को तो होएगा ही, ऐसे ही बोल दोगे तो भी होएगा.
correct. So, if your life had a theme song, what would that be?
Oh my God. So I think I'm actually learning singing now.
Okay.
That's my late hobby. So I
तो आप
think
कुछ गा के सुनाएंगे आप?
रुक जाना नहीं तू कहीं हार के, कांटों के चल के मिलेंगे साए बहार के, रुक जाना नहीं
वाह,
तू कहीं हार के. दूसरा, मैं जिंदगी के साथ नशे में उड़ाता चला गया. So all must type of song. And my mother's favorite, which also has become my favorite, because she was delivering a lot of babies, 7, 8 babies every day. So she used to always come up from the hospital. We will live. ये लाल रंग कब मुझे छोड़ेगा. That PPH was always on our head.
that's a good song for
For a gynac.
yes, absolutely. So, if you could have one superpower to help pregnant women, what would that be?
I would make all women deliver in the hospital. So when I said ki if we make you the health minister of India, I was asked this question long back. What will you do? I said I'll make roads. He said health minister और road क्यों बनाओगे? I said रोग महिला जब तक हॉस्पिटल आने के लिए उसको नहीं है वो मैं बचा नहीं सकता. So if a woman can come to the hospital, we can save her. It's not that we don't have the skill. It's the society who has to decide whether we want to save that girl, woman. So I'll make roads and make them all deliver in the hospital.
So now, if you are, if you think about pregnancy as trimesters, like the first trimester, second trimester, and third trimester, is there some Bollywood movie that you can associate each of them to be?
So so first trimester was the good news, I think. The good news is coming. And और या तेरे मेरे सपने. Or then what second trimester when probably the woman starts feeling तो दिल धड़कता है और she has mood changes तो कभी खुशी कभी गम could be one of them. Or when delivery is imminent और third trimester होने वाला है, एक फूल दो माली.
Wow.
I think.
A great choice of movies for all
और
of this.
इंग्लिश वाली तो मिशन इम्पॉसिबल, इनसाइड आउट. These movies have शादी के साइड इफेक्ट.
We have lots of movies that you can attach to each of these trimesters.
या
So
कोई मिल गया.
कोई मिल गया या so आपने जो like इतने सारे deliveries किए होंगे, which is the funniest experience you've had? Is there something that brings a smile to your face when you think about it?
So funniest experience has been many,
Okay.
because these women when they are in pain they will talk whatever they want, and sometimes they'll be very abusive to the husbands also. तूने तो कहा था इसमें सिर्फ मजा ही मजा है, ये क्या है? तूने तो कहा था. So that was the most hilarious thing out. And we were students in Aligarh Medical College, and this Muslim lady bearing down and abusing her husband. तूने तो कहा था ये सब फन के लिए हो रहा है, ये सब इसके लिए हो रहा है, ये थोड़ा ना होना था ये. So, something like that is there. And then one when there was no ultrasound, so we had one baby came out and we were all washing out. Then suddenly nurse said, "Doctor, एक और है, एक और है." So वो deliver किया. And then all चले twins होंगे ना, और इससे ज्यादा तो होंगे. And third one also came. So
Wow.
3 undiagnosed triplets was a way, and everybody in the labor room was like, अरे पहले से नहीं पता था. Then poor girl lady saying, तीन तीन कहाँ से कर दिए, मैंने तो एक ही नहीं आई थी. And तीनों boys थे. And that husband बाहर में कहता है, इनको कैसे पालूंगा, 3 लड़के लफंगे गुंडे निकलेंगे, मैं क्या करूंगा.
So
So
did you
they
see
get
them?
very, I mean,
तीनों को
people
देखा
talk
आपने बाद
whatever
में?
they are, and then they are very happy, and then they'll come back and say, sorry, हमने ये सब बोला.
बट बाद में आके उन तीनों बच्चों से आपने
अरे
आपको
वो
कभी
3
मिले?
जो कह रहा था, हमने कहा 2 3 मेरे पास छोड़ जा. आज वो आज वो तीनों टीनेजर्स हैं, टीनेजर नहीं, अब तो 20 साल से ऊपर के हैं, और तीनों को मिलाने लाया था अभी थोड़े दिन पहले. एंड ऑल 3 ब्रिलियंट स्टूडेंट्स, एंड यू फील सो गुड. आई सेड अब छोड़ जा दो.
अब नहीं
दूध
छोड़ेंगे।
कैसे पिलाऊंगा? दूध के डब्बे के 2 साल के जेदी पर मैंने अपनी एनजीओ से उसको मिल्क मिल्क बॉक्सेस दिए पिलाने के लिए, बिकॉज ही वॉज इन सच अ शॉक कि मैं इतना गरीब एक टीटी कंडक्टर था शायद रेलवेज में.
So,
So things
आपके
happen
कोई भी
very nice.
is the father allowed in the delivery room, and did you see any father fainting?
Yes, we are allowing
Yeah.
all fathers, and I tell them देखो faint नहीं हुए तो ये allow करूंगा. So we allow them towards the mother's side, on the mother's head, and we put a curtain so they can see and talk to each other and are not seeing the actual process of a cesarean or a normal delivery. And the baby, as soon as we deliver, we have a now a habit of putting it to the breast on the table only before we cut the cord also. So the father is also a part in the first breastfeeding or the what we call as skin to skin touch. And the mother can kiss her baby and feel the baby, and both of them can touch the baby, and we take a good picture. But there have been two incidences when one father just puked and he had to be, and one all fainted. I mean, he sat down, he didn't fall, but he sat down, and we two nurses had to shift him. So it is very difficult for men to see blood. They get scared with a small cut of 2 drops of blood, and they, oh, I mar gaya main to. They have not seen how women bleed during normal pregnancies also. So 500-600 ml blood to ऐसे ही जाता है. So a lot of men can't see that, and that makes it a little difficult if we allow them. But we are allowing. Whoever wants to come in is allowed to see.
तो आज के जमाने में आई एम श्योर मेनी पीपल do research on Google. So has any patient come and told you how you should treat them?
All of them. There's a
All of them.
signboard outside me. If you have read Google, my fees is double because I have to teach you how to forget what you read in Google and then. So this Dr. Google Kaur, I'm sure she is a Sardarni. I hope my wife is not watching. She's also from that
मैं
family.
सेपरेटली भेज दूंगी उनको.
So Google Core is is a good media to tell you broadly what will go on. But if you go into specific things, it will highlight some of the side effects which actually are very rare and will not happen. And these people will pick up that only and come and ask you and pester you about that, which is 1 in 10,000. And that will be their first question. So I said, उसको ऊपर नहीं पढ़ा क्या बोला Google ने. So go to make them relearn Google and
Unlearn.
is a, and now with AI coming in is going to be even probably worse for us because now the ChatGPT 4, which is there, the new one, which is a paid version, can actually converse with you emotionally. So I've seen it. I acted as a patient with this one. And I said, I started crying. Then I said, कि मेरा बच्चा नहीं हो रहा है, मेरा ये नहीं हो रहा है. And that lady on the other side of the chat, artificial, she talked to me in a very empathetic, emotional. So I mean, which probably doctors will have no time to do that. So it is going to open up a new challenge to the doctor. The virtual doctor versus the real doctor is going to be the challenge.
Interesting. I think we have to see how ultimately AI will be used in the future. So if you had a magic wand to erase one medical problem off the face of the earth,
Anemia.
which one?
Anemia.
Anemia.
खून की कमी. एनीमिया अगर हम लोग हटा पाए 80% ऑफ डिजीज फ्री हो जाएंगे. Only one anemia, and we have not been able to do it. My thing was 24/7 anemia bhagao. Every president, abhi Dr. Rishikesh Pai, anemia, Nana, anemia yatra, anemia ye, 12 by 12, हर 12 years का 12 होना चाहिए hemoglobin. We have tried everything. We have tried deworming everybody, deworming tablet to all pregnant women, everywhere. Still, this anemia is not leaving us. So if we have a magic wand, anemia को हटा दें तो आधे से ज्यादा बीमारी ठीक हो जाएंगी.
So I think that was the end of my rapid fire. I would just like to see if you can give final any 2, 3 pieces of advice for everybody, all the viewers who are watching it, people who are planning to have babies or people in general who are watching this, thinking about, their life and whether they should go ahead with pregnancy or not.
तो 2-3 एडवाइस है. एक जनरल लोगों के लिए एडवाइस है, जिंदगी न मिलेगी दोबारा, हैव फन. being rich, being poor, no money, no stress, absolutely does not matter with your life. You are going to live this life only once, and today is only once, and yesterday is gone. So don't worry about yesterday, and tomorrow is not yet come. So you don't know what is there. Enjoy today. That's why. The second advice is smile. Smile for no reason. Anyone you meet on the road, just smile. It's the most beautiful curve on the human body. It's not 36, 24, 36. It's the smile. This is the best curve. And just smiling at anyone, everyone, whoever, there's a worker there, just put a hand and just smile. And you see the change you'll bring into his or her life. And then finally, your life. And of course, then eat well, have disciplined life, not over disciplined, but a disciplined life. Enjoy a few times, uh, a couple of times cheating in fast food and eating and binging on a couple of drinks is all allowed in life, but be careful with a limit. So be careful with the limit, because you're going to live it only. And if you fall sick, then no one is going to look after. And get yourself very well insured, because that is where your money. And don't save money for your children. Spend it all on yourself. Don't leave it for them. They'll earn themselves. So that is my few advices.
That's some great set of advice that you have given us. So thank you so much. I think it has been a pleasure. I think we went थोड़ा सा 1 घंटे से ज़्यादा ही time ले लिया आपका, but I think
Thank you.
it was great. I think great learning for a lot of people who are listening in and watching us on this podcast. And hopefully I'll get to meet you in person soon again. So, thank you once again.
Sure, love to. Thank you. Thank you very much. Thank you very much for inviting me. Thank you.